Hello, everyone, and welcome to another edition of Booming Encore's Learning Bites. My name is Susan Williams, and I'm the founder of Booming Encore. And today I'm delighted to be joined again by Dr. Rhonda Collins, Chief Medical Officer at Revera. And today we're actually going to be talking about the very interesting and sometimes confusing world of medical cannabis, and its use for older adults. Now, before we actually get started, I do want to make sure that everyone is aware that there are different laws concerning the use of cannabis products and medications, depending on where you live. And as well, all the information that we're actually providing today is strictly for informational purposes. You should always consult your own physician prior to taking any type of medication. So with that said, welcome, Dr. Collins.
Hi, Susan. Happy to be back.
Great to have you. Now, Dr. Collins, there's just so many terms out there for cannabis, marijuana, and then there's the recreational use, and then there's the medical use. Could you possibly just explain a little bit about what all of this means?
Sure. Before we get started, I do want to, for the sake of transparency, let your viewers know that I have received a financial stipend from Spectrum Therapeutics, a subsidiary of Canopy Growth, because I'm involved in a study through the Ontario Long-Term Care Association on the effects of cannabis in older adults. And so I'm on the Cannabis Advisory Committee as well as the expert panel. And that is why I received compensation for my involvement in those roles.
Terrific. Thanks for making that clarification. I really appreciate it.
My pleasure. And that said, I'm not a proponent of or an opponent of cannabis. I just really want to see some results from some studies because we don't have anything with regard to older adults right now that's substantive that would make me say yes or no, we should be prescribing medical cannabis for older adults for particular indications. And we can kind of talk about that as we go along. So to your first question, yeah, there's been a lot of conversation. Medical cannabis has been legal since 2001. And recreational cannabis, as you know, was just legalized in 2018. So there's been a lot of buzz about that, no pun intended, about that since it became legalized. And one of the pieces of information I'm trying to disseminate to people is the difference between recreational and medical cannabis. So the cannabis plant has about 500 compounds in it. And we know that over 100 of those, the number changes all the time. It's 104, it's 113, it's probably going to grow. But those are chemical compounds called cannabinoids. And the two that you've heard the most about are THC, so a tetrahydrocannabinol, and CBD, cannabidiol. And the reason they're important is because THC is what gives us the high when we smoke pot, when one smokes pot. That's the psychoactive effect that people are looking for, that euphoria with THC. CBD doesn't have that euphoric effect. It's not psychoactive. And it's important because I'm going to try and keep this a little high level and not go too deep into the weeds, but we have this endocannabinoid system in our body, which is kind of fascinating. It was discovered in the 1990s by scientists. We have these chemical molecules called endocannabinoids that we produce in certain situations. They're like neurotransmitters, so think of serotonin or dopamine, and they attach to receptors in the body, and originally found in the brain and the nervous system, and now they've been located in other areas of the body, like in the heart, in the lungs, in the reproductive system, in the muscles. And this is really important because the endocannabinoid system is believed to be involved in processes like pain management and sleep and reproduction and all these processes that happen in our bodies. So there's a lot of research going into what external cannabinoids like THC and CBD can actually do to those processes in our bodies, and why these endocannabinoids we produce act like cannabis molecules. So lots of good thoughts and ideas about how cannabis can help people with symptoms like chronic pain, like insomnia, anxiety, depression.
Terrific. And now, just for our viewers' purposes, when we're talking legalization, that's legalization in Canada, not necessarily in the US, depending on the state that you're in. Legally, you have to just check the laws there. Now, what's the primary cannabis medications being used for medical purposes?
So there's a few. So in Canada, we have Nabalone. I'm sure a lot of people have heard about that. It's a synthetic THC. In the States, there's dronabinol. That's not available in Canada. There's also another nasal spray that is 50% CBD and 50 the equal components of CBD and THC. It's being used for people with muscular spasticity because of multiple sclerosis. That is not available in Canada either. And then there's different cannabis manufacturers, medical cannabis manufacturers, like Spectrum, for instance, that makes a variety of cannabis products, soft gel capsules and oils that will contain varying ratios of THC and CBD. And that is really important because what we know so far is we want to avoid the psychoactive effects from a medical cannabis perspective. We want to get the medical benefit from the CBD, but there are certain things that have been shown to respond to THC. So sometimes having a little bit of THC with the CBD, and I'm going to give insomnia as an example, may be beneficial. And so it's kind of finding that ratio of CBD to THC that's most beneficial for the symptom that's being targeted.
And what are some of those symptoms that are being targeted?
There has been so much research. Up to this point, it was primarily done on recreational cannabis, so it makes it a little bit hard to extrapolate the data. Health Canada has a 1,000-page document on all of the studies that have been done for every specific symptom that you could think of. So pain is a big one, and chronic neuropathic pain, so pain that involves the nerve root. So think of somebody who's had a stroke or somebody who has diabetes and has nerve damage from their diabetes. Sciatica is a good example of a neuropathic pain. It's nerve impingement, a trapped nerve that's causing that burning, stinging-like pain that goes down the leg. So that type of pain has actually been shown to improve with medical cannabis. There's been studies on nausea and vomiting from chemotherapy. There's been studies on palliative care and end-of-life care where it can ameliorate some of the symptoms of depression, insomnia, nausea, vomiting because of chemotherapy or because of the cancer process itself. They've looked at it in epilepsy. There's some decent evidence in epilepsy, particularly certain drug-resistant types of epilepsy. And so there's so much research being done. What we don't have is good research on people over the age of 65, because like anything else, there are risks and benefits to any type of treatment.
And so just on that vein, what are some of those risks?
Well, so my concern particularly, one of the things that we're looking at in the study, the Cannabis and Older Person Study in Long-Term Care, one of the things we're looking at is those agitated behaviors that can be the result of certain types of dementia. Oftentimes as dementia progresses, there is agitation and irritability that can turn into responsive behavior, so being physically and verbally responsive to other people. They're common amongst people with dementia, and they're very difficult to treat. There are a lot of medications being used to treat those types of symptoms, and those are also very risky. So we think of antipsychotics and sedatives and hypnotics. Those carry a lot of risk for older adults because they increase risk of dizziness and drowsiness and falls. And so looking for an alternative strategy, the idea is that because of the cognitive effects that cannabis can have, can we settle some of these behaviors with cannabis? I'm not convinced. I'm eager to see the results of the study. I would really like to get some good evidence, either for or against. Like I said, I'm not a proponent or an opponent. What I really want is good evidence to say, yes, this is effective, or no, this is either ineffective or not safe. But I really have to be concerned about our population, my population, particularly in long-term care, but the general population. Think about things like drowsiness and dizziness and its effect on driving, for instance. So, people living at home, drowsiness and dizziness as an older adult, as our bodies change, we have changes to our muscles, for instance, that put us at higher risk for falls. And so if you're already at a higher risk for falls, and then we add a pharmaceutical or a non-pharmaceutical that can increase that risk, it's making things worse. So those are the things that I'm really concerned about. As well, Health Canada advises that certain people shouldn't be taking cannabis. And so if you have specifically heart and lung diseases, if you've had a heart attack or a stroke, they advise against it. If you're on certain medications, like the medications I talked about, antipsychotics, antidepressants, sedatives, that increase your risk, those should be avoided. So again, it's like anything else. If I were to tell you, if you were to ask me what to take for a headache, I may say Tylenol, or I may say ibuprofen, or I may say naproxen, because not everything works for everybody, and everybody responds differently to everything. We have a genetic makeup for pharmacology that determines how we will respond, whether we will have a good effect or a bad effect from certain medications. And so I think that that's really important.
So I guess that raises the question then, when should someone consider using them and how should they even go about doing that?
Well, it's interesting, Susan, because the largest growing demographic of cannabis users is people over the age of 65. And there's a lot of postulated reasons for that. One is that a lot of people were afraid to use it before it was legalized, and now that it's legalized, it's fair game. But I think the largest thing that I'm hearing from people is they're either experiencing chronic symptoms that are either not responding to the current medications that they're taking, or they're having side effects from the medications they're taking. And so people are looking for alternative strategies. Not everybody wants to be on opioids, for example. I mean, we hear all the time on the news about the opioid crisis. And so if people are taking fentanyl or Percocets or Dilaudid, hydromorphone, we know that there are side effects associated with those medications. We also know that there's benefit associated with them. And so it kind of becomes challenging when to make the decision that this is no longer working, or this is intolerable to me because of the side effects, and I want to try a different strategy. So you mentioned at the very beginning, always talking to your healthcare practitioner is the most important thing to do, because you have a relationship with that practitioner. And that's really most important. A lot of physicians are not comfortable prescribing at this stage because of the lack of evidence, but there are physicians who are very skilled and experienced at prescribing. There are cannabis clinics with physicians who have been trained in prescribing and knowing the types of symptoms to monitor for. That's one of the things we're doing in our study, is making sure that we have a really good protocol in place, that we're looking for risks before we consider somebody, that we're identifying those people who are potential candidates and those people who are not candidates, starting at a very, very low dose and titrating really slowly, and monitoring for effects and discontinuing when we see effects. So those are some of the things that have to be considered.
Yeah, I think people just have to remember this is actually a drug, is it not?
It is, yeah. And it's a drug that we don't, I mean, think about how much rigor a medication has to go through before it's approved by the FDA or by Health Canada. And so we've got some studies based on something that used to be recreational. And again, I need to point out, recreational cannabis is primarily THC, which is the psychoactive component. And so there is a big difference. And one of the reasons I was so interested in doing this study was because I didn't want well-meaning family members and friends using recreational cannabis for their loved ones if they couldn't get access to medical cannabis. I think if we have a product that's legal, that's great, but it doesn't necessarily mean it's safe. And it doesn't mean it's right for everybody. And I know that there is a lot of, if you Google, medical cannabis, you're going to see 1,000 web pages that talk about, this being the cure-all for everything. It's absolutely not. And we need to, exercise caution when we're thinking about this.
Absolutely. Caution is definitely the means to approach this. Now, can you at all comment on what you've discovered so far in the study, or is it still a bit too early?
It's still a bit too early. Right now, we have some evidence of benefit in a few people. We have some evidence of no benefit in a few people. We wanted this to be a really large study. and it was kind of slow to get off the ground. It now it's in all of the homes. It's not just my homes that are involved in this study. There are other homes as well, but it's finally off the ground as of a couple of months ago. So I think it's a little premature to talk about any results at this time.
Okay, well, we'll then definitely have to have you back once those results are ready.
Yeah, that'd be great.
Okay,
Always a
terrific.
pleasure to be here.
Well, thanks so much again for your time. Really appreciate it. As I mentioned at the beginning, this is often a very confusing topic, and I really value the fact that you're trying to give us some sort of guidance here on how and when to use this product. And so just one more time, if you are considering it, please make sure you consult with your healthcare practitioner prior to using anything. This is actually a drug. So to everyone out there, hope you found this information valuable and it helps you live your best booming encore. Bye for now, everyone.